Today I want to talk about the SI joint, specifically what is it and what causes problems there. So let's start off with the bony anatomy. You got your pelvis and your sacrum. So it's really three bones that all move independently of each other. There's very little motion, but it does move. Okay, so sacrum, pelvis, pelvis. You've got the joint right here. So this is where irritation can occur, here or here. Sometimes it's both. If you look at the joint, if you Google SI joint ligaments, this whole area is wrapped, like it looks like shrink wrap in tons of ligaments. Ligaments can be a source of pain, a big source of pain, and they don't stretch. They're not contractile like a muscle. They're kind of like pieces of tape holding the skeleton together. So if they're constantly placed on strain, over time they get loosened and get irritated. And what they can do is leak onto your sciatic nerve. Sciatic nerve comes up from your spine, from 3 levels of your spine, comes down this way and all the way down your leg. So sometimes you get leakage from inflammation, either the joints or the ligaments or both. And that can cause like symptoms like sciatica. Okay, so what causes it? Well, it's usually either stiffness issue or a weakness issue, and sometimes both. So let's start off with the stiffness part. Now, remember this is a 3D object. You've got muscles attached to all sides of it. On the back side, you've got your back muscles that pull this way. You've got your hamstrings and glutes that pull this way. And the green is going to be the front side. The front side, you got muscles that attach to the ASIS, and then you got muscles that do this as well, okay, down here on the AIIS. All right, so what happens is if you have imbalances in any of these muscles, you can put a lot of shear force on one side of the pelvis, specifically the SI joint, every step you take. That's one of those things that usually happens over time, over years and years of having, say, one hamstring maybe pulling down a little harder on this one side. That's what generally causes it. So to fix it, you basically have to balance out the system. So that's what we do in an evaluation. We look at your hamstrings, your back, all the muscles that attach, your hip flexors, all the muscles that attach to your pelvis. And if we find any sort of gross asymmetries, we do our best to correct that. It's a little bit of a fallacy to think that everyone's going to be perfectly symmetric, but the closer we get you to symmetric, usually this goes away. So that is kind of the stiffness component. What we also see will be a weakness component. There is a group of muscles that sit around here, okay? Your hip abductors, glute medius and minimus specifically, they have a huge role in stabilizing the pelvis. So what does that look like? So when you are walking, and remember walking is a series of being on one leg, those hip abductors have a role in stabilizing the pelvis. So right here, this right side, the hip abductors are on. If I turn them off, this is what happens. And you'll see this a lot. People kind of stand like this, disengaged here. Okay, so it's becoming destabilized. So usually one of the biggest holes in an SI dysfunction is weakness in these hip abductors. They have two main motions. They do hip abduction, right? And they do this leveling of the pelvis. So usually I'm going to look at somebody, see if we have some stiffness issues, see if we have weakness specifically in here, and correct all those things. There is sort of a third muscle that kind of goes along for a ride sometimes. You've got your femur, it kind of comes out this way. And you got a piriformis attaches to here, all the way out to here. And sometimes you're going to have stiffness on one side or weakness on one side and cause either instability or sort of like a jamming of the sacrum into the joint.